Hello, my name is Tim Rabatoy. I'm a strength and conditioning specialist and the creator of the Falling Solution System. I'll be your host today. This is the most complete resource on falling skills, fall recovery techniques, and fall prevention exercise and conditioning available anywhere in the world. I'd like to welcome you to the Falling Solution System.
Welcome to the Fall Prevention Exercise Library. In this section, I've brought together all the exercises that I've found to be the most effective for fall prevention that I've used with hundreds of patients over the years in physical therapy. In the Falling Solution System, I talked about several different elements that all combine to increase our chances of falling. Not only environmental factors like lighting in your home or personal risk factors like vision or hearing, but physically, the loss of muscle strength, loss of balance, stability, agility, coordination, flexibility, along with poor posture, all combine to increase our chances of falling as well. This demonstration library has groups of exercises, stretches, and movements to help you improve in every single one of these areas. In each part of the section, I'll take you through groups of exercises for each area. I'll give you up-close demonstrations of each exercise, and I'll give you some variations you can use along the way to make it more or less challenging if you need to. As we talked about in Part 5 of the Falling Solution System, people naturally lose 1% of their muscle mass every year after the age of 25. So a 75-year-old may have lost up to 50% of their muscle mass. Muscle weakness is one of the main reasons that falls happen in the first place. So maintaining your muscle mass and trying to increase your strength is one of the most critical things you can do to prevent falls. And the only way to maintain or build your muscles is with consistent exercise. In Part 1, I'll show you my 15 favorite strength exercises for fall prevention so you can start building muscle and improving your strength and stability right away. Lack of flexibility and poor posture have both been linked to increased falls and fall-related injuries. If your muscles are tight and stiff, you're not able to react as fluidly or as quickly as you could to a falling situation, and you'll have a greater chance of injury and you'll have more trouble getting back up. And the worse your posture is, and the more out of alignment you are, the harder the rest of the muscles of your body have to fight to keep you in balance. As I mentioned in Part 5 of the Falling Solution System, for every inch that your head is forward, it increases the weight of your head on your spine by 10 pounds. So as an example, if your head is 4 more inches forward than it should be, that's like 40 pounds pulling you forward all the time. Flexibility and posture go hand in hand. So in Part 2, I'll show you 11 stretches to improve your flexibility, and then you'll see my 10 favorite exercises for improving your posture. Exercises that challenge your balance or movements that mimic some of the quick steps and changes you need to make in a falling situation can make a big difference in actually preventing a fall. When a falling situation occurs, your muscles are stronger and your reactions are quicker, and your body is much more ready to move and much more ready to react to prevent a fall from happening in the first place. In Part 3, I'll show you my 10 favorite balance and agility movements for fall prevention. And then in the next section, I've taken the exercises that you'll learn here and organized them into 3 easy to follow along workouts that you can do anytime, anywhere. They include techniques and movements in all the important areas, and you don't need any special equipment at all to do them. Part 1, strength exercises for fall prevention, coming up next. Welcome to Part 1 of the Fall Prevention Exercise Library. In this part of the section, I'll be showing you my 15 favorite strength exercises for fall prevention and the ones that I've found most effective in building muscle strength quickly with older adults. I'll take you through each exercise step by step, and then I'll give you some variations and alternatives along the way so you can make the exercises more or less challenging as you need to. Exercise 1 is just basic sitting and standing, and this is a great stability and power exercise for the upper leg muscles. Sitting in a stable chair, make sure to keep your eyes up, cross your arms over your chest if you can, and then stand up and sit back down under control. For your breathing, try to blow your air out while you stand and breathe in as you go down. If you need to hold on with your hands, just make sure to make your legs do as much of the work as you possibly can. To progress without your hands, you can try sitting and standing from a higher surface, or you can add pillows to your chair to make it higher. To make this exercise more challenging, instead of just adding repetitions, try coming up powerfully and then coming down as slowly as you can. Remember that no matter what age you are, you need to challenge yourself in order to get stronger. Instead of picking a number of repetitions to do, see how many you can do, and then try to build on top of that as you get stronger. Since we're trying to build strength, to challenge yourself, just do as many repetitions of each exercise as you comfortably can. Take a rest for a minute or two, and then do a second set of as many as you can before moving on to the next exercise. Exercise 2 is a squatting exercise, and this is another great one for the muscles of the upper thighs, hips, and the muscles around the knees. Holding on to a sturdy countertop or a stable chair, keep your eyes up and then slow and under control, squat down as low as you comfortably can and then push yourself back up. Blow your air out as you push up and then breathe in on the way down. For a little extra challenge, you can try squatting down and holding in place for a few moments before coming up. Or just like the sit to stand, you can also go down a little more slowly before coming up to make it harder. My main mission in creating the Falling Solution DVD series has been to put together a resource that gives you as many practical, real-world strategies for dealing with a falling situation as possible. From actual falling skills, getting yourself back up in any environment, or exercise training to prevent falls from happening in the first place. Several of the exercises you'll see here are not only great at building general strength and balance, but they're designed to train your body to be strong and stable in the positions you might face in an everyday falling situation or fall recovery emergency. My focus is to give you exercises that train your muscles in the same way you might need them in a real-life situation, and you can be sure that your body will be much better at making those same movements when it really counts. Exercise 3 is a forward lunge, and this is a great exercise for fall prevention because it works the same muscles you need when you put your foot out to stop yourself from falling forward. Holding on to a stable chair or a countertop, take a step forward and lunge down as far as you comfortably can, and then push back up before switching legs. Blow your air out when you push up and breathe in on the way down. To protect your knees, make sure your knee doesn't go out in front of your toe when you lunge. You never know what direction you might need to step in quickly to keep yourself from falling down. Exercise 4 is called a sideways lunge for your hip and upper leg, and this one helps build the muscles you need to stop yourself from falling to the side. Holding onto a chair or a countertop, keep your body straight, keep your eyes up, and with your toes facing forward, take a step sideways and then lunge down as far as you comfortably can, and then push yourself back up before switching sides. Blow your air out as you push up and breathe in on the way down. Exercise 5 is called a heel raise. To have good balance, you need to have strong foot and lower leg muscles. Studies have shown a big connection between a lack of lower leg strength and an increased likelihood of falling. Even trying to balance on one leg has as much to do with the muscles of your feet and your ankles as it does with all the other muscles of your body. Step onto a stair so that your toes and the balls of your feet are on the stair and leave room for your heels to hang off the back to stretch. Make sure you have railings to hold on to, and then try to come up onto your big toes as high as you comfortably can, and then come back down slow and under control so your heels can stretch towards the floor at the bottom. Blow your air out on the way up and breathe in on the way down. To make this exercise a little easier, or if you don't have access to a step, try standing at a countertop or a stable chair and try heel raising from the floor instead. Exercise 6 is a basic forward step up. As we age, over time we tend to stop lifting our toes and start shuffling our feet more and more as we walk. We also stop lifting our feet as high as we should when we step. Both of these factors increase our chances of tripping on something and falling down. So training your body to lift your feet nice and high on a consistent basis with exercises like step ups and hip hikes make it a lot easier to do the same thing in the real world. Make sure to have railings to hold on to if you need them. Standing up straight with your eyes looking forward, step up with one foot first and then the other. When you get tired, make sure to switch feet and then repeat. Exercise 7 is a sideways step up. Make sure to have a railing to hold on to. Standing up straight with your eyes looking forward, step onto a stair and then step up with your other foot. When you get tired, make sure to switch feet and then repeat. Exercise 8 for the lower body is called a bridge, and this is the first of our mat exercises. Like the bridge, several of our mat exercises will help you strengthen the stabilizing muscles of the trunk. As I'll talk about in a moment, having strong trunk muscles is extremely important for your balance and stability, both in fall prevention and fall recovery. For the bridge, lie on your back, put your hands down at your side with your palms down, and with your feet flat, tighten your trunk muscles to stabilize your back and lift your belly button towards the ceiling as high as you can. Hold for a second, then lower yourself back down slow and under control, and then repeat. Blow your air out on the way up and breathe in on the way down. To make this exercise more challenging as you get stronger, there are several things you can do. You can try holding in place for a few moments at the top of the movement before coming back down. To make your trunk and legs do all the work, you can try crossing your arms over your chest and then lifting up. You can challenge your trunk further by making fly movements with your arms at the same time as you're holding your bridge. And to strengthen the muscles on the front of the lower leg and to make the glutes and hamstrings work more, you can try lifting your toes and staying on your heels the entire time you're bridging up.
Okay, in just a minute, I'm going to give you several trunk exercises to work the abdominals and obliques and low back muscles, the muscles that are responsible for stabilizing your low back. The muscles here around the trunk also have a big part to play in your balance. If the muscles in here are weak, your upper body is always going to be moving around while you're trying to stabilize yourself. So there's just one thing I wanted to talk about before we got into the trunk exercises, and that's your neutral position for your back. This is the best way not to hurt your back while you're working your abdominal muscles. So here's the idea. Your neutral position is just the most natural position for your low back. So your natural position for your low back has a small curvature in it. So when you lie down on your back to exercise, like on the mat here, take your hand and put it underneath your low back. There should be a little bit of a space there. It shouldn't be pressed totally flat. Your spine should not be pressed totally flat to the mat. There should be a little bit of a space there, a natural space. That's your neutral position. That's the position you want to maintain the entire exercise. So once you notice that space there, you want to tighten the trunk muscles. And as you're moving with one of the abdominal exercises I'll show you in a minute, this is our ab reach. With this exercise, what we want is stability through here. We don't want the spine tilting one way and then the other way. We want it to be nice and stable the whole time. We want to maintain that little space the entire exercise. Okay, so while you're working, you want to be nice and stable through here. What you don't want is your spine tilting like this. So with these exercises, you don't want to reach too far, like this. Okay? Anything that's making your spine tilt and move during your trunk exercises is no good. So another time to think about your trunk muscles, as I mentioned just a moment ago, was during your balance exercises too. So when you're balancing, for instance, standing on one leg, when you're standing on one leg, try to think about tightening the muscles in through here, the same muscles that we were working on the trunk exercises. Try to stabilize your body here. You might even want to try using a mirror that you can look at while you're doing your balance exercises. It makes a big difference when you can actually see what's happening when you're trying to balance on one leg or the other, and it can actually tell you a lot about your balance. So when you go to balance on one leg, or any of the other balance exercises, but this is just a good example, try to stabilize your trunk while you're doing it. It makes a big difference for your balance.
The next 7 exercises are my favorites for building good trunk strength to improve your balance and stability when you're on your feet, and upper body strength to help you easily push yourself back up. Our first strength exercise for the upper body is called an ab scissors, and this is a great exercise to start engaging the trunk muscles that you use to hold yourself steady when you balance or when you try to push yourself back up. Lie on your back, bring your legs up to 90 degrees and your arms directly over your chest. Bring your arms and legs apart as far as you comfortably can and then back together under control. As I mentioned in the short lecture just a minute ago, try to stay in your neutral position the entire exercise by tightening your trunk muscles to keep your low back stable. Make sure to breathe in as you open and breathe out as you come back together. Exercise 2 is called an ab reach, and this is another great way to strengthen your trunk and abdominal muscles. Lie on your back, bring your legs up to 90 degrees and your arms directly over your chest. Maintain the neutral position the entire exercise by tightening your trunk muscles to stabilize your low back. As your arms come over your head, reach out a short distance with your legs at the same time, and then slow and under control, come back to the middle, and then repeat. Breathe in as you reach away, and breathe out as you come back in. Exercise 3 is called an alternating ab reach, and this one activates the muscles on the sides of the trunk a bit more than the first 2 exercises. Lie on your back, bring your legs up to 90 degrees, and your arms directly over your chest. Try to maintain the neutral position the entire exercise by tightening your trunk muscles to stabilize your low back. As one hand reaches over the head, the opposite leg should reach away, and then under control, come back to the middle and then alternate. Breathe in as you reach away, and breathe out as you come back in. Exercise 4 is called a prone plank, and this is a great trunk strength and stability exercise, and this one, along with the next 3 exercises, are vitally important to building the strength you need for fall recovery as well. Lie on your front this time with your body straight and put pads under your knees if you need to. Bring your elbows under your armpits and push yourself up onto your knees and forearms at the same time and hold there as long as you comfortably can before coming back down. Just like the other trunk exercises, try to keep your low back in a safe, neutral position the entire exercise by tightening your trunk muscles to keep your low back stable. Blow your air out as you come up and then take little breaths in and out while you're holding your plank. Exercise 5 is called a stability reach, and depending on your strength level, you can try this exercise a few different ways. Start on your hands and knees and put pads under your knees if you need to. Tighten your trunk muscles to keep your low back and hips as stable as possible the entire exercise. For all 3 versions of this exercise, try to pretend that you're balancing a full glass of water on your low back and you're trying not to spill a drop. Version 1 is just try to stay completely stable through the trunk and low back while you reach directly out with one hand and then bring it back down slow and under control before switching arms and repeating. Breathe out as you reach away and breathe in as you come back down. In version 2, to make this exercise a little more challenging, stay steady on your arms this time, keep the rest of your body as stable as you can, and reach directly back with one leg at a time before coming back down and trying the other side. In version 3, similar to the alternating reach on your back, try reaching out with one arm and the opposite leg at the same time before coming back down and repeating on the other side. Exercise 6 is a modified push-up, and this exercise is perfect for building the strength you need for fall recovery and to get yourself back up from the floor every single time. Lie on your front with your arms at your sides in a push-up position and your legs straight. This is my favorite version, called the Nelson push-up, and we're using the pillow to help keep the low back in a safe position and the pads under the knees for comfort. Tighten your trunk muscles to keep your low back as stable as possible the entire exercise, and then push yourself up onto your knees and then come back down slow and under control. Breathe out as you push up and breathe in on the way down. If you need to make this exercise a little easier, stay on your knees, keep your eyes on your legs as you come down, and bring your head to the mat and then push yourself back up. If you can't do the versions on the mat, you can also try this exercise standing as well. You can try this exercise standing, leaning over a surface like a countertop, and you can also try it leaning towards a wall if you're just starting out. And strength exercise 7 for the upper body is called a chair push-up, and this is a great exercise for the shoulders and triceps, and it works perfectly to help build the pushing strength you need for fall recovery. Sit a little bit forward in a stable chair with your hands on the handles. With your body straight and your eyes looking straight ahead, push yourself up until your arms are straight, hold for a moment or two, and then come back down slow and under control. Blow your air out as you lift, and breathe in as you come back down. To add a little more challenge to this exercise, after pushing up, try holding for longer periods of time or holding as long as you can before coming back down. That concludes part 1 of the Fall Prevention Exercise Library, but in part 2, I'll show you how to improve your flexibility and posture to prevent falls. Part 2, 21 stretches and posture exercises for fall prevention, coming up next. Welcome to part 2 of the Fall Prevention Exercise Library. Flexibility and posture are extremely important, but often completely overlooked factors when it comes to falling. In this part of the section, I'll show you 11 effective stretches to help give you the flexibility you need to react more quickly and more fluidly during a falling situation. And then I'll give you 10 posture exercises to reestablish your alignment and improve your balance and help prevent falls from happening in the first place. As we talked about in part 2 of the falling solution system, studies have shown that when falling to the side, changing fall direction quickly is the most effective way of minimizing your chances of a broken hip, and that if you can quickly turn your body forwards during a sideways fall, it can reduce your chances of a broken hip by up to 15 times. But remember, your ability to turn your body far enough forward to avoid landing on your hip is limited by your flexibility. If your body can't turn when it really counts, you'll be much more likely to come down in a position that could cause a major injury during a fall. And as you start to work through some of the exercises in part 3, you'll see that your ability to turn your head plays a major role in your standing and moving balance. Tight muscles don't let you move your body very well. If muscles are tight and bound up and stiff, they not only make it more difficult to step quickly to keep yourself from falling if you trip or stumble, but they also tend to pull your body into a bad posture. And remember that if you're always leaning forward due to poor posture, your body is also constantly out of balance when you're on your feet. Poor posture is completely destructive for the body, and it not only affects your spinal cord, muscles, bones, joints, internal organs, nerves, and blood flow, it can also drastically affect your balance and will definitely increase your chances of falling down in the future. As I talked about in the introduction, if your head is as little as 4 inches more forward than it should be, that's like 40 pounds pulling you forward every moment you're on your feet. And for every inch your head moves forward, you can add another 10 pounds to that. So if you have poor posture, your body's at a huge disadvantage when you're trying to balance yourself, and even the smallest changes can make a big difference for preventing falls. All the posture exercises you'll see here are the ones I've found to be the most effective for reversing poor posture. They're easy to do anywhere, they only take a few minutes of your time, and they're all designed to help bring your body safely back into a natural alignment. When it comes to the body, remember that it's the whole combination of factors like poor posture and flexibility, but also the slow loss of muscle strength over time and the loss of balance, stability, coordination, and agility that work together to make you more likely to fall. The exercises in each part of this library are all designed to work together in combination to help you prevent falls and injuries by improving your body in every one of these areas. The following stretches all work together collectively to improve your range of motion, your balance, and your overall flexibility, and they'll help to improve your posture as well. Small improvements in any one of these areas will help decrease your chances of falling down. For each stretch, I'll give you a quick overview on technique, I'll tell you how long to hold each one, and how many to do before moving on to the next exercise. Stretch number 1 is a standing calf stretch on the stairs, and this is a great way to stretch the tight calf muscles in the back of the lower legs. As we talked about in part 1, having strong lower leg muscles is extremely important for balance, but having really tight calf muscles limits the range of motion and dexterity for your feet, and it also limits your ability to lift your feet as high as you should when you walk or step over things. Start in the same position as the calf raise, holding onto the railings with your feet halfway onto the step. Standing up straight with your eyes looking forward, let your heels stretch towards the ground as far as you comfortably can. Hold your stretch for 30 to 60 seconds, take a short rest, and then try it again. Try 3 times in a row before moving on to the next exercise. As we go along, make sure to move through each stretch nice and slow with no bouncing or jerking at any point during the movement. And improvements in your flexibility happen gradually over time, so don't try to force stiff muscles to stretch. Make sure to only stretch as far as you comfortably can without pushing to the point of pain. Stretch number 2 is for the hamstring muscles, which are the large muscles in the back of the upper legs that extend from the knee to the hips. Lie on your back with one knee bent. Put your other foot in the loop of a stretching strap, a dog leash, or even a large towel. Then, keeping your leg as straight as possible, bring it up as high as you comfortably can until you feel a stretch through the back of the upper leg. Hold this stretch for 30 to 60 seconds and then bring it down nice and slow, and then try your other leg. Try 3 times with each leg before moving on to the next exercise. Stretch number 3 is a sideline quad stretch, and this is for the thigh or quadricep muscles in the front of the upper leg. Lie on your side with your head supported and your knees bent at about 90 degrees. Holding onto your top leg at the ankle, gently pull your leg back away from the body until you feel a good stretch through the thigh muscles. Hold it for 30 to 60 seconds and then roll to the other side and try the other leg. Try 3 times with each leg before moving on. Stretch number 4 is called a piriformis stretch, and number 5 is called a figure 4 hip stretch. These two work perfectly in combination, so you can do them at the same time, and they're great for improving the flexibility and range of motion to the muscles around the hips. For stretch 4, lie on your back with both knees bent, and then cross the foot of one leg over the other. And with both hands, pull your knee up and in towards your opposite shoulder until you feel a good stretch in the outer and upper hip muscles. Hold the stretch for 30 to 60 seconds and then push your knee directly away from you into stretch number 5 and hold that for 30 to 60 seconds. Make sure to switch legs and try each combination 3 times on each side before moving on to the next exercise. Stretch number 6 is called a trunk roll, and this is a great way to improve the range of motion in your hips and low back and improve the rotation of your trunk. Lie on your back with your knees bent and your arms at your sides. With your knees together, let them slowly drop to one side as far as you comfortably can, and hold for 5 to 10 seconds before coming back to the middle and going the other way. Try 10 times each way before moving on to the next exercise. Stretch number 7 is called a book opening stretch, and this is excellent for not only improving your trunk rotation, but it incorporates your upper back and neck rotation as well. Lie on your side with your head supported and your knees bent on top of each other, and extend your arms completely straight out in front of your chest with your palms together. Keeping your eyes on your top hand the whole time and keeping your bottom hand on the mat, reach away from you and then up towards the ceiling as you turn your body. Let your arms stretch as far to the other side as you comfortably can and hold this position for 5 to 10 seconds before coming back to your starting position and repeating. Try 10 times in a row and then turn over and try 10 times on the other side. Stretch number 8 is called a floor snow angel, and this, along with the next 2 stretches, work to improve the range of motion in your shoulders, arms, upper back, and chest. Even small improvements in any of these locations can make it much easier to improve your posture in the same areas. Lie on your back with your knees bent, your arms at your sides, and your palms facing up. Keeping the backs of your hands on the mat the whole time, try sliding your arms up the mat as high as you comfortably can. Hold your highest position for 5 to 10 seconds and then slide back down to your starting position and then repeat. Try 10 times in a row before moving on to the next exercise. If your hands don't slide well on the surface that you're on, you can try putting a towel underneath your arms to make it easier. Keeping your palms up the whole time, just do the exercise the same way. Stretch number 9 is another great movement for rounded shoulder posture called a reverse snow angel. Lie face down with your body straight and put a roll of towels or a folded pillow underneath your chin and collarbones to support you. With your arms at your sides and your hands palms down the whole time, slide your arms as high over your head as you comfortably can and hold this position for 5 to 10 seconds before sliding back down to your starting position and repeating. Try 10 times in a row before moving on. Stretch number 10 is called an overhead reach. Lie on your back with your knees bent and your arms directly over your chest with your hands together. Keeping your arms as straight as possible, slowly reach over your head to stretch as far as you comfortably can. Hold your highest position for 5 to 10 seconds and then come back to the middle nice and slow. Try 10 times in a row before moving on to the next exercise. And fall prevention stretch number 11 is called a supported neck rotation, and this is a great way to improve the practical flexibility in your neck. Just like the importance of being able to turn your head to see in a car, turning your head without resistance from stiff muscles and ligaments actually makes a big difference for your safety and balance when you're walking and you need to turn your head and move at the same time. The walk with head turns in the next section on balance will help you build on the benefits of this one as well. Lie on your back with your knees bent and your arms relaxed at your sides. With the back of your head supported on the mat, turn your head as far as you comfortably can to one side and hold your stretch for 5 to 10 seconds before coming back to the middle and going the other way. Try 10 times on each side. If you notice a real lack of flexibility in your neck, here's a few more stretches you can add to your list. To stretch the muscles on the side of the neck, try a lateral neck stretch by keeping your shoulders down and then letting your ear drop towards your shoulder. Hold for 5 to 10 seconds before going the other way and try 10 times on each side. To stretch some of the muscles in the back of the neck, you can turn your head to 45 degrees and then drop your chin slowly towards your chest. Hold this one for 15 to 30 seconds and then try the other side and make sure to try 3 times each way. Make sure to use a mirror when you're assessing your posture, and if possible, have someone take a picture of you from the front, the back, and the side in your normal relaxed position. Seeing what your posture looks like is a key first step in knowing where you need to make changes and focus more of your attention. Once you've identified where you need to make changes, you can use the posture exercises coming up in Gallery 2 to help you make improvements in the exact areas you need to work on. For correct posture, when you look at yourself from the side, your ear, shoulder, hip, knee, and ankle should line up in one straight line. When you see yourself from the front or the back, you should be symmetrical on both sides without excessive leaning towards one side or the other. Remember that most of our posture problems are not just changes that come with aging, but usually the result of years and years of bad posture habits that combine to bring us further and further out of alignment. The exercises in Gallery 2 are great for helping to reverse bad posture, but awareness of your posture and changing your daily habits in the way you hold yourself when standing, sitting, and moving help to reinforce all the changes that the exercises can make. Once you evaluate your posture and start going through these movements, at the same time, try to make an effort every day to stand up as tall and as straight as you can and maintain the best posture you can when going throughout your day. It's the combination of consistent posture exercises working together with good posture habits in all that you do that will result in the permanent changes that you want to see in the future. Now that you know where you need to make some changes, the exercises up next are all designed to help you improve by stretching and retraining the muscles and joints in the opposite direction of the poor posture. For each of the next 10 posture exercises, I'll give you a brief overview on technique, I'll tell you how long to hold each one, and then I'll tell you how many to do before moving on to the next exercise. The first posture exercise that we'll look at is called a chin tuck head press, and this is a great movement for bringing your head and neck back into alignment with your spine. As we've talked about, poor posture often starts with the head moving forward. So if you can bring the head back into position with your ears in line with your shoulders, it's a great start to correcting the rest of your posture. This exercise helps to realign the head and neck and retrain the spine by gently putting force in the opposite direction of the offending posture. Lie on your back with your knees bent and your arms relaxed at your sides with your palms up. Gently tuck your chin towards your chest and press your head directly down into the mat at the same time, using about 30% effort. Hold this position for 5 seconds and then relax for a moment before repeating. Try 10 times in a row before moving on to the next exercise. Exercise number 2 is called a chin tuck head lift, and this is another great movement for reestablishing the alignment of your head and cervical spine by making the muscles stabilize in the opposite direction of the poor posture. Lie face down with your legs straight and your arms folded in front of you to support your head. To anchor your lower body, gently press your pelvis straight down into the mat and maintain gentle pressure the entire exercise. Gently tuck your chin towards your chest and lift your head at the same time, trying to bring your ears in line with your shoulders. Hold this position for 5 seconds before slowly coming back down and try 10 times in a row before moving on. Exercise number 3 is called a chin tuck upper body lift, and this one takes our head lift and then brings the upper and lower back muscles into the exercise as well. Lie face down with your legs straight and your head supported by a pillow or a towel on the forehead, or you can also put a roll of towels underneath your chin and collarbones to support you. Put your arms at your sides with your palms facing up. To anchor your lower body, gently press your pelvis straight down into the mat and maintain gentle pressure the entire exercise. Once again, tuck your chin towards your chest and then lift your head and upper body off the mat as high as you comfortably can at the same time. Hold this position for 5 seconds and then slowly lower yourself back down under control. Try 10 times in a row if you can. Exercise 4 is called a shoulder press, and this one focuses on helping with the realignment of rounded shoulders. With poor posture, as the head and upper back lean too far forward, it starts a chain reaction, which makes the shoulders start to round forward as well to compensate. This exercise helps retrain your shoulders by putting sustained pressure in the opposite direction of the poor posture. Lie on your back with your knees bent and your arms at your sides with your palms up. Press your shoulders back into the mat with about 30% effort, like you were trying to squeeze your shoulder blades together. Hold each squeeze for 5 seconds and try 10 times before moving on. Exercise 5 is called an advanced shoulder press, and this one builds on the last exercise by incorporating some of the larger muscles of the upper and mid back, as well as the muscles between the shoulder blades. Lie on your back with your knees bent and bring your arms out to your sides with your arms bent at 90 degrees and your fists extending towards the ceiling. Just like the shoulder press, press your elbows straight down into the mat, trying to squeeze the shoulder blades together. Hold each squeeze for 5 seconds and try 10 times in a row before moving on. Exercise 6 is called an elbow press, and this is another great movement for helping to reestablish good shoulder and upper back posture and loosen up some of the tight and restricting areas around the shoulder blades. Lie on your back with your knees bent and bring your hands together behind your head. Press your elbows down into the mat with about 30% effort and hold this position for 5 seconds, and then bring your elbows as close together as possible for 5 seconds before coming back down and repeating. Try 10 times in both directions before moving on. And if you can't get your elbows all the way down to the mat at first, just use a pillow or two underneath your elbows so you have something to push against. As your shoulder posture improves, you can take the pillows away in steps until you can reach the mat with your elbows. Exercise number 7 is called a punch-pinch combination, and this one works for shoulder posture by retraining, strengthening, and stretching the muscles involved in protracting and retracting your shoulders. Lie on your back with your knees bent and your arms extended straight above your chest. In the punch part of the movement, keeping the rest of your body on the mat, make fists with each hand and reach towards the ceiling as far as you comfortably can and hold for 5 seconds. And then for the pinch part of the movement, keeping your arms straight, use the muscles between the shoulder blades to pull your arms back down by pinching your shoulder blades together and hold for 5 seconds. Make sure you're not excessively shrugging your shoulders towards your ears during the movement. Try 10 times in both directions before moving on. Exercise number 8 is called a standing shoulder blade squeeze, and this, along with the next 2 exercises, helps you to build on the improvements that you made on the mat and increase your natural range of motion in a standing position. Stand up as straight as you can with your arms at your sides and your eyes looking straight ahead. Turn your palms facing forward and without shrugging your shoulders upward, pull your shoulders straight back by squeezing your shoulder blades together. Hold this position for 5 seconds and try 10 times in a row before moving on. Exercise 9 is called a standing shoulder extension. Stand up as straight as possible with your arms at your sides. Without leaning forward with your upper body and maintaining your posture, turn your palms facing backward and then press your arms back as far as you comfortably can and hold this position for 5 seconds. Try 10 times before moving on to the next exercise. And exercise 10 for the posture is called a standing W stretch. Stand up as straight as you can with your eyes looking straight ahead and bring your arms out to the sides of your head with your arms bent at 90 degrees and your fingers extending towards the ceiling. From this position, without shrugging your shoulders, bring your arms back as far as you comfortably can by squeezing your shoulder blades together. After holding for 5 seconds, bring your hands and elbows together in front of your face and hold for another 5 seconds before squeezing back and repeating. Once again, make sure to try 10 times in both directions before moving on. That concludes part 2 of the Fall Prevention Exercise Library, but in part 3, I'll show you 10 exercises that'll help you avoid falls by improving your balance and coordination on your feet and training your muscles to be able to step and move and react quickly when you need to avoid falling down in the first place. Part 3, 10 balance and agility exercises for fall prevention, coming up next. Welcome to part 3 of the Fall Prevention Exercise Library, 10 balance and agility exercises for fall prevention. Sometimes all it takes is one misstep, one trip, one stumble, or one move in the wrong direction to end up falling down and getting injured. As we get older and we stop participating in sports and activities where we have to move and balance and stabilize our bodies in all kinds of different directions, we not only lose muscle mass, but we also lose the ability to make the kinds of quick reactions and movements that are sometimes necessary to avoid falling down. Being able to move safely in different directions and being able to react and step quickly in order to regain your balance after tripping or losing your footing is essential for preventing falls. So the more practice you have in coordinating your movement in different directions, negotiating obstacles, and balancing and stabilizing your body in different positions, the more balanced you'll be no matter where you are. You'll also be in much better condition to make the kind of movements necessary to prevent yourself from falling. The exercises you'll see up next will help you prevent falls by improving your standing and moving balance, improving your ability to step quickly to support yourself when you need to, and training your body to be safe, stable, and coordinated when moving in different directions. For each of the exercises, I'll give you a brief overview on technique, I'll discuss how long to do each one before moving on, and I'll give you alternatives and variations along the way so you can make it more or less challenging as you need to. Exercise 1 is called a single leg stand. Standing on one leg for time stimulates lots of muscle groups that are important for your balance. Holding yourself in one place trains muscles in your toes, your feet, your ankles, and your hips. But it's also great training for your trunk muscles to hold your upper body still at the same time. For feedback, try watching yourself balance in a mirror if you can. Stand up straight with your eyes looking straight ahead, and then stand on one leg and bend the other leg to 90 degrees. Make sure to try and tighten your trunk muscles to hold your upper body as stable as possible the entire exercise. Stay on one leg for as long as you comfortably can and then switch sides. Try 3 times on each side before moving on to the next exercise. If you can't balance on one leg, or if you have trouble holding your position for more than a few seconds, then just use a countertop or a chair to hold onto for safety, and then just keep it close by as you improve. Exercise 2 is called a line walk, and this is a great balance and stability exercise because it not only makes the trunk muscles have to work to reduce the movement and sway of the upper body, but it trains your coordination and it makes the muscles of the feet and toes work hard to keep you stable as well. Stand up straight with your eyes looking straight ahead and try walking heel to toe, going as straight as you can the entire exercise, just like you were walking down a line. Go for a distance that challenges you, take a rest, and then try it again. Try at least 2 times before moving on to the next exercise. If you can't walk heel to toe, or if you can only do it for a few seconds, here's a few variations you can try. If you need to hold on to something, just do your line walk next to a chair or a countertop for safety, but when using the chair, make sure to use it only as much as you need to, so the rest of your body gets the benefit. Another variation you can try, if you can't bring your feet completely in line, is just trying to walk with your feet as close as you can get them to each other. For a little variation and challenge to this exercise, you can also try standing heel to toe in one place and trying to hold as steady as you can for time. For this variation, make sure to switch foot positions and do equal work on both sides. Exercise 3 is called a toe walk, and this movement trains several areas that are heavily involved in your balance at the same time. It's not only great for building stability in the ankles, but also muscle strength and endurance in the feet, toes, and calf muscles. Standing up straight with your eyes looking straight ahead, try coming up onto your big toes as high as possible and walk as far as you comfortably can. Make sure to try at least 2 times before moving on to the next exercise. If you can't stay up on your toes or you need some extra support, make sure to stand next to a chair or a countertop for safety and then keep it close by while you improve. For a little variation and challenge on this exercise, you can also try balancing on your toes, trying to hold yourself in one place for as long as you can. Exercise 4 is called a heel walk, and this movement is great for fall prevention because it builds stability in the ankles and it trains the main muscle on the front of the lower leg, which is responsible for lifting your feet when you walk. Over time, as we stop participating in sports and activities that require lots of movement, we also stop lifting our feet as high as we should when we're walking or using the stairs or stepping over things. If you can't lift your toes and feet as high as you should when you're walking, it not only affects your movement and your balance, but it strongly increases the likelihood of stumbling, tripping over your own feet, or catching your foot on an obstacle and falling down in the future. Stand up straight with your eyes looking straight ahead and lifting your toes as high as possible and keeping them up the entire exercise. Try walking on your heels as far as you comfortably can until you need to take a rest. Find a challenging distance for you and try it at least 2 times before moving on to the next exercise. If you can't stay on your heels or you need extra support, make sure to try heel walking next to a countertop or a chair and keep it close by as you improve. For a variation and a challenge, try staying on your heels and holding in one place for as long as possible. Exercise number 5 is called a hip hike walk, and this is a great movement for improving your balance and training the hip flexor muscles that we use to lift our knees when we step and move over obstacles. This exercise also incorporates the muscles on the front of the lower leg as well. Stand up straight with your eyes looking straight ahead, and maintaining a good posture in a marching motion, lift your knees, feet, and toes as high as you comfortably can while moving in a forward direction. Find a challenging distance for you and try it at least 2 times before moving on to the next exercise. If you need more support, you can use a countertop or a chair to hold onto for safety and then keep it close by as you improve. Exercise 6 is called a head turn walk, and this is a fantastic exercise for improving your spatial awareness and training your vestibular system, which plays a big part in your sense of balance and control when you're on your feet. Stand up straight with your eyes looking straight ahead and walk at a normal pace, turning your head one way every few steps and then the other way. As you're walking, try to stay on a straight course and try not to let your body drift to the left or the right. Make sure to choose a challenging distance before moving on to the next exercise. If you need some extra support, just try holding onto a countertop or a chair and keep it close by as you improve. Exercise 7 is called a lateral walk. If you trip or lose your footing, it's important to have the ability to take quick and stable steps in any direction that you need to go to avoid falling down. This movement is great for increasing hip strength and improving balance and awareness, but more importantly, it trains your body to be able to make strong, stable, and coordinated steps in a sideways direction when you need to. Stand up straight with your eyes looking forward the entire exercise and your toes pointing straight ahead. Move to the side by stepping as far as you comfortably can and then bringing your feet together and repeating. Find a challenging distance for you and make sure to switch sides and do the same distance the other way, leading with the opposite leg. Try at least 1 time on each side before moving to the next exercise. If you need some extra support, make sure to stand at a countertop or a chair for safety and make your legs do as much of the work as you can. Exercise number 8 is called a forward agility step, And this is a great exercise to improve your coordination and your forward and backward stepping pattern, as well as good training for lifting your feet higher when you step over obstacles. For this exercise, lay down a rope or a cord or something similar in a straight line that you can use to step over. Standing up straight and in a 1-2 pattern, step over with one foot at a time and then step directly back to your starting position. If possible, try to stay on the balls of your feet, keeping your heels off the ground the entire exercise. Do as many repetitions as you comfortably can and try at least 2 times before moving on to the next exercise. When performing this movement, make sure to try one with the right foot leading off the exercise, and then try the next set with your left foot leading off the exercise. If you need extra support, make sure to hold on to a countertop or a chair and keep it close by as you improve. As you work through the program and get stronger, you can also slowly increase the height of the obstacles to challenge yourself. And for a challenging variation on this exercise, you can try a Wilson step, where you cross one foot over the other as well as the obstacle while moving forwards in a straight line. Exercise 9 is called a sideways agility step, and this one not only helps you to lift your feet more effectively and negotiate obstacles, but it also improves your coordination and your ability to move fluidly in a sideways direction. For this exercise, once again, lay down a rope or something similar that you can use to step over. Stand up straight with your toes pointing straight ahead and start by taking a step leading with the leg on the same side as the direction you want to move in. And then follow with your other foot in the same over and back pattern as the last exercise and keep moving in that direction. Try to stay on the balls of your feet and keep your heels from touching the ground the entire exercise. Find a challenging distance for you and then make sure to switch sides and lead with the opposite leg coming back the other way. Try at least 1 time on each side before moving on. Just like the forward agility step, if you don't have anything to use or you don't feel ready to use an obstacle, just try the exercise using a crack or an imaginary line on the floor. If you need some extra support, make sure to hold on to a countertop or a chair and keep it close by as you improve. And for a variation and a challenge on this exercise, you can try putting your rope in a circle and do your sideways agility steps going in one direction and then the other. And balance and agility exercise 10 for fall prevention is called a grapevine step. This one is excellent for coordinating your movement, and it's especially good for training your feet to be able to step and recover quickly and effectively if you happen to trip or stumble. Stand up straight with your eyes looking straight ahead, and in a 4-part movement, take a big step with your leading leg, and then step in front with the following leg. Step with the leading leg again, and then step behind with the following leg in a continuing pattern as you move to the side. Once again, find a challenging distance for you, but make sure to try the same distance the other way, leading with the opposite leg. Try at least 1 time on each side before moving on. If you need some extra support, make sure to do this exercise at a countertop or a chair and keep it close by as you improve. That concludes part 3 of the Fall Prevention Exercise Library, but in the next section I'll show you how to use all the exercises you've learned so far in 3 easy to follow along workouts that you can start doing at home right away. Fall prevention workouts coming up next.